Since 1984, the Demographic and Health Surveys Program has provided assistance to developing countries in the collection and use of data to monitor and evaluate population, health, and nutrition programs. For over 30 years, this program has been funded by the United States Agency for International Development and has been implemented by the same team at ICF. The first DHS survey was conducted in 1985, and since then, the DHS program has collected, analyzed, and disseminated high-quality representative data on population, health, HIV, and nutrition through more than 300 surveys in over 90 countries. ICF works with a variety of partners to implement the DHS program in 5-year cycles. The DHS program has 3 key objectives. The first is to assist countries in the collection of high-quality data to inform policies, programs, and monitoring and evaluation activities. Our surveys follow a standard design and use common questionnaires and fieldwork procedures that build on 30 years of best practices in survey research. This standardized approach allows comparisons of data across countries and time and helps to ensure quality and maintain ethical standards for survey research. The DHS program's second key objective is to foster and reinforce host country ownership at all survey stages, including data collection, analysis, presentation, and use. The DHS program surveys are conducted by a local implementing agency in each country, most often the country's National Bureau of Statistics. The DHS program provides technical assistance to the host country implementing agency as it manages every stage of the survey. Local stakeholders are also consulted during the survey design and questionnaire development. Countries can choose to include country-specific questions or additional modules on special topics, such as maternal mortality, female genital cutting, domestic violence, or child development. The third objective of the DHS program is to increase the capacity of host country partners, both to collect and use data. To this end, staff from the implementing agency are trained at every stage of the survey, from sample design to fieldwork supervision, from biomarker data collection to data processing, from report writing to dissemination and use and analysis of data. This is done through on-the-job mentoring, formal workshops, distance learning, and online tools. The DHS program is most well known for their flagship survey, also called the Demographic and Health Survey, or DHS. The DHS is a nationally representative survey of households, women, and men. It collects data on fertility, mortality, family planning, maternal and child health, nutrition, HIV/AIDS, and other health indicators. Thousands of women and men are interviewed, and in many cases, biomarker data such as height and weight and blood samples for lab testing are also collected. Many countries implement a DHS approximately every 5 years. The Malaria Indicator Survey, or MIS, uses a subset of the DHS survey and focuses on malaria-related indicators, including mosquito net ownership and use, preventive treatment for pregnant women, and prevalence and treatment of fever in children. The MIS often includes testing for malaria and/or anemia. The DHS and MIS are both household surveys. The DHS program also implements a survey of health facilities, called the Service Provision Assessment, or SPA. The SPA collects data on service readiness and quality of care via facility inventory, interviews with providers and clients, and observations of client-provider consultations. The DHS program constantly strives to develop innovative methodologies and procedures, and to incorporate new technologies to improve data quality. DHS has made huge strides in adopting computer-assisted personal interviewing, computer-assisted field editing, and collecting and ethically sharing GPS data for geographical analysis. The DHS Wealth Index sheds light on the relationship between household wealth and health without having to collect information on income. The ultimate goal of a DHS survey is not simply to provide high-quality data, but to make sure those data are used to inform programs and policies. To foster data use, DHS data are made available to the public for free in a variety of formats, from infographics to datasets for analysis. In addition, the DHS program works directly with journalists, policymakers, and program managers to build their capacity in evidence-based decision-making. We also train researchers in secondary analysis of DHS data, as in our Fellows Program for university faculty from Africa and Asia. For more than 3 decades, the DHS program has delivered high-quality data while championing host country ownership and capacity strengthening. This would not have been possible without the millions of women and men who have responded to DHS questionnaires, the hundreds of thousands of local staff who have implemented surveys, the countless DHS data users across the world, and the unwavering support of USAID. We look forward to continuing these efforts to collect and use data to improve health and well-being around the world. For more information on any of these topics, visit the DHS program website and follow us on social media.